anniversary EU event. So thank you for joining us today. I'm Aude Boisset, and I'm the General Delegate of the European Federation for Family Employment and Home Care, member of the Alliance. We represent private households employing domestic workers directly at EU level, and I'm glad to moderate this session. Before going deeper in the subject, I'm in charge of sharing a few technical details. I will share my screen. Okay. Okay, so this event will be recorded and made available after the event on members of the Alliance social media channels. For questions, please use the Q&A button on the control bar. Feel free to share your comments in the chat box, and I will be in charge to monitor the question. And after the presentation, we will have around 20 minutes for Q&A session. If you have technical concern, please address a message in the Zoom chat, and our colleagues from ESPD will be glad to help you in any way. Also, very important interpretation. It will be provided during the event in English, French, Italian, German, Polish, Romanian, and Spanish. And so in order to choose your preferred language, please use the button on the lower part of your screen in the Zoom panel. But in today's session, speakers will be speaking in English and Italian. Okay, so in this panel, we would like to discuss how decision makers can improve the situation of migrant domestic workers in Europe by improving regular pathways for migration, but also implementing regularization schemes and addressing particular challenges for migrant domestic workers' labor rights. But first, before presenting the speakers, a little bit of context, because it's a fact in Europe, a significant proportion of domestic work is carried out by migrants. According to ILO estimates for 2013, in at least 55.6% of the 4.1 million domestic workers in Northern, Southern, and Western Europe were migrant workers. They also estimated that there was 1.8 million women migrant domestic workers, representing 65.8% of female domestic workers in this region. Very often, there's no public acknowledged that the demand for domestic workers across Europe is growing, while labor force shortage in the sector continue to exist. And often this demand is met by undocumented migrant workers. Also, there's a lack of data to highlight the positive contribution of intra-EU and extra-EU migrants, the challenges to access decent and declared employment in domestic work are multiplied for migrant domestic workers. Also, there's a risk of precariousness, even more important when domestic workers are migrants. So they may have a precarious or irregular resident status, face risk of immigration enforcement if they stand up for their rights, and they also face specific challenges in terms of recognition of skills and qualifications. So today in the panel, and I will share my screen. Okay, today in the panel, we will have 6 speakers, a presentation of the stakes of the sector, and then a focus from all over Europe in Italy, UK, the Netherlands, Switzerland, and Central and Eastern Europe. But without further notice, let's start with our first panelist. Hello, Lilana. It's very nice to see you. Lilana Kiss, you are a Senior Advocacy Officer at PICUM, the Platform for International Cooperation on Undocumented Migrants. So it's a network of 168 member organizations in 34 countries working for human rights and social justice for undocumented migrants. So you will present issues at stakes, major challenging facing migrant domestic workers, but also concrete proposals So thank you, Lilana, for joining us. And you will be speaking in English. So the floor is yours, and you have around 10 minutes.
Wonderful, thanks, Aude. And as one of the co-organizers for this conference, thank you on behalf of PCOM to everybody for being here. Can I share my screen? I think I can't whilst you're sharing, Aude.
Oh.
Should now work?
Yes, perfectly.
Yes? Okay, great. Key issues at stake and concrete proposals from our side. For us, the starting point when looking at the situation of migrant domestic workers is that the challenges stem from an intersection of structural discrimination, which is linked to gender inequalities and gender discrimination, sectoral challenges around domestic work, including the historical lack of recognition of domestic workers' work and the consequent lack of regulation and fight, which the Domestic Workers Convention has addressed, as well as discrimination related to migration status. And I would like to highlight how this manifests in two particular challenges today, which is the lack of adequate regular pathways for migration, or very restrictive ones when they do exist, as well as specific challenges for migrant workers to actually exercise their labor rights. In terms of labor migration pathways, we can say in general that across the region, there is a focus on promoting labor migration for people with job offers and contracts for very high income, or otherwise for very specific occupations. When it comes specifically to domestic work, we've been in touch with frontline organizations to try and really map out the situation. It's not been done since 2011 by the Fundamental Rights Agency. So we've managed to cover 17 countries so far, and we're looking at migration pathways that are not for people working for diplomatic households, because that's quite separate. And we found that in nearly half, 8 of the countries that we've looked at, domestic work is either not eligible for a permit, except if there's previous employment outside of the country. So you're already working for a family in another country, for example, in the UK, and we're going to hear more about the UK situation later. Or if they're not excluded from general work permit schemes, but the conditions on those schemes mean that it's really rarely possible in practice. And the major issues that we see are things like labor market tests and income thresholds, which block domestic work from actually being an eligible occupation in practice. So because of time, I'll just give 1 or 2 examples. But in Austria, there's a points-based system where people have to reach 55 points. It'd be very difficult for a domestic worker to do so, but not impossible in terms of education and these kinds of things. But there's also a very high minimum income threshold, which would be very difficult for a domestic worker. In Belgium, it's only possible, now it's different in each of the different regions in Belgium, but for example, the labor market test would block access for a domestic worker. So that's the labor market test is just preferential access to the labor market to an EU national or a locally residing third country national with already access to the labor market. So it's impossible to pass that as a domestic worker, except if you would be applying for the Brussels capital region as a live-in domestic worker in one of the countries where there's a bilateral labor migration agreement. So it's just these 9 specific countries. Then in 5, we found that it's possible for some specific groups, but with major practical barriers still. So again, just one example, in Czech, it is possible for nationals of 9 countries, Belarus, India, Kazakhstan, Moldova, Mongolia, Montenegro, Philippines, Serbia, and the Ukraine, to get permits as housekeepers, but there's a quota per country. And because of undeclared work in the sector and other issues, it's really hard to get that contract that you would still need. So these are just some of the issues that we're coming up against. In 4, we found only of the 17 we looked at so far, it's really possible for domestic workers to get permits. That's not to say there's not challenges, and I'll come back to that. So what we see is a highly complex labour migration system for both workers and employers to navigate, particularly when we're thinking that employers are private households or individuals, and a situation where many domestic workers are working undeclared and undocumented. It's either not possible for them to get a permit, or it's far too complicated. And this also means that there's a misuse of au pair systems, cultural exchange programs for youth, where actually people are working as domestic workers under those programs. We also see that the policies are leading to labor exploitation. As I mentioned, in most countries that do provide permits, there is major challenges still. One of the main points is the right to change employer. It can be possible in certain circumstances, but normally it's very, very complicated. You have to apply for a new permit from outside of the country or show specific paperwork, and it gets to a situation where there's really very high dependence of the workers on their employers, because they can't really easily change without having to leave the country probably. And once people are undocumented, there's very few possibilities to regularize their status as domestic workers. And the key point also being around labor rights. How can you exercise your labor rights and your right to fair wages for working time we've been hearing about today, the enforcement gaps that we've been hearing about? How can you exercise them if you are in an undocumented situation? Now, people do have the rights when they're undocumented, but we see that there's some real issues around them being able to actually access the complaints mechanisms like labor inspections or employment tribunals without some risk of immigration enforcement as a result. There's also major challenges around proving an employment relationship when you're undocumented and you don't have a contract, and showing how much you've been underpaid. You know, you've been paid part of your wages, but not all of it. But major issue is also this firewall, where there's no real protection or no firewall to mean that when people engage with complaints mechanisms, which are supposed to protect workers, they actually have their rights protected only as workers and don't risk any immigration enforcement. That also applies in situations of more severe abuse, where somebody would be a victim of crime, that there's big issues in terms of engagement with law enforcement and police, that police often prioritize immigration enforcement over victim protection. So all this means that there's a lack of choices and power for workers to negotiate with employers, unequal treatment in terms of labor conditions, additional risks that they face, especially if living in terms of isolation and restrictions on their movement and lack of access to their own private space. And also risks of people becoming undocumented because of exploitation as domestic workers, because their permits are dependent. And members have also signaled 1st of July is coming up, which is the end at the moment for EU nationals in the UK to apply for settled status. So we're going to expect some precarious workers, including isolated domestic workers, not having known that they were able to apply for that status or being able to provide the necessary documents and risk becoming undocumented on July 1st. So what do we recommend to address all this? Applying and enforcing all labour standards for all workers, regardless of their status. And that means effective complaints mechanisms, enabling workers to file a complaint and access all the available remedies without any immigration enforcement consequences, including domestic workers. And that's really important for all workers, but particularly with the issues around inspections of private households, the workplace of domestic workers. Complaints mechanisms are absolutely crucial for labour inspectors to be able to target resources and uphold domestic workers' rights. We're also working towards ensuring access to services, protection and justice for all undocumented people, especially if they have been experiencing any kind of exploitation, criminal exploitation or violence in the workplace. We are also calling for an investment in the sector overall, recognizing that these are structural challenges, and also including domestic and care workers in the general work permit schemes, really in practice, meaningfully, that people can get a work permit, that work permit enables them to change employer and have full access to labor and social rights. So really the kind of permits that promote decent work and social inclusion, both for people outside of the country and inside of the country through regularization pathways. And finally, a point that I haven't touched on here today, except to say we didn't look at it in the mapping, but we see major issues with the enforcement of labor rights for employees of diplomatic households. So improving regulation of that employment and also of recruitment agencies and au pair agencies that are involved in the employment of domestic workers. Thank you.
Thank you, Liliana. Very, very good timing. And thank you for showing us the barriers and complexity of the situation for migrant domestic workers in Europe. And also highlighting this recommendation and showing us that it's crucial to apply and enforce labor standards for all workers, regardless of their status. I now turn myself to Francesca. Good afternoon, Francesca. You are a lecturer in sociology of work at the University of Padua. Your principal field of research has been the female migration from Eastern to Western Europe, and then you investigate its impact on migrant workers in Italy with a gender perspective. And recently you entered a new field of research, so occupational health, and in particular you studied female migrant workers' health. So thank you for agreeing to present today your Italian case study. So the floor is yours, and as for your co-speakers, please keep it to around 10 minutes. Thank you.
Un secondo che condivido la mia presentazione. Sorry. Bene, buon pomeriggio a tutti e tutte, grazie per questo invito, è un piacere per me.
Pleasure to present to you this research study. I'm basing my presentation on the migrant domestic workers' health, which is focusing particularly on the crossroads between health conditions of domestic workers, particularly female domestic workers, and the health conditions of other workers employed in other sectors of the labour market. So just some background information first. As has already been said on multiple occasions today during this conference, migrant women are strongly segregated into specific sectors of the labour market, particularly in the domestic care sector. In Italy, there are certain national groups that are concentrated, particularly in the domestic care sector. These people tend to come from Eastern Europe, Romania, Moldova, Ukraine, and then there are the Philippines and the Latin Americans. So these nationalities are more concentrated in domestic care. Now, studies relating to health of domestic care workers are limited. This is because the available studies tend to be qualitative as opposed to quantitative, but they are useful. They have shown that migrant workers working in the domestic care sector are at risk of experiencing forms of violence, whether this be physical, verbal, or sexual. They suffer from musculoskeletal diseases, particularly those associated with care tasks, caregiving tasks. For example, they often have to lift elderly people who are unable to move themselves. These workers, often working in apartments and households, are often subject to respiratory difficulties because they are often using chemicals. And so this literature shed light on the fact that there are frequent problems, mental problems associated with domestic workers, particularly caregivers and people who are working for the elderly or people who are very dependent. So they often experience feelings of isolation and loneliness. So here are some of the gaps that we have identified in the literature. As I said earlier, this is qualitative research. No comparative studies have been done. So we don't know whether female domestic workers are more exposed than other migrant workers to health problems. We don't know how damaging or how difficult their work is. So with this research that we conducted in Padua in Italy, we carried out a case study and we decided to try and investigate this. We wanted to analyze the health conditions of migrant women employed in different job sectors in the labour market. And we also wanted to carry out a quantitative analysis and then carry out a further more in-depth analysis of the specific nature of health problems that migrant workers experienced in the domestic care sector. Now, the methodology. We conducted a survey, a representative non-random survey on 173 migrants from Moldova in Padua. Now, why Moldovan? Well, that's because they are highly represented in the domestic care sector. We wanted to have as homogeneous of a sample as possible in terms of socio-demographic and cultural aspects. Otherwise, we thought this might influence the results of our research. So as I said earlier, we then carried out a more in-depth analysis through interviews, again, of Moldovan domestic workers, only employed in household care, in the domestic care sector. Today, though, I'm going to focus on the results of the survey. You can see some of the main characteristics of the sample. The two highest represented groups were home care workers. In Italy, these are called maybe family assistants or badanti in Italian, so carers. So and then the second group were home cleaners or cleaning ladies. Then in the other groups, we can see waitresses, nurses, blue collar workers, industrial cleaners, and those in the manufacturing industry. Here you can see the age distribution. They coincide with the general characteristics of the Moldovan population present in Italy. It is actually quite an elderly population, and they have been living in Italy for quite a long time. 44% of our sample were women who had been living in Italy for between 10 and 15 years. So that's quite a significant amount of time. Now, getting to the health aspect of our research. As you can see in this table here, our interviewers gave answers to questions relating to their health. So we could see what they were suffering from before they emigrated and what they suffered from after they emigrated. So the question was health problems that had been diagnosed by a doctor. We really needed them to be diagnosed rather than self-diagnosed. In most cases for domestic workers, many of them stated there were a higher percentage of them saying they had health problems of all sorts. So arthritis, depression, for example. And all migrants said that their health condition deteriorated after emigration. Another fact that emerged from our research was we wanted to look into mental health. We had a whole series of questions. The Hopkins Symptoms Checklist, which aims to assess emotional well-being or psychological well-being. And we can see that in total, 22%, almost 23% of our interviewees had problems with mental health. More specifically, this text spoke of anxiety and depression. So this is a very important figure. And the highest percentage of people suffering from this was domestic care workers. I'm going to skip this slide. And now there is burnout. We investigated the syndrome of burnout in home care, and we saw that domestic care workers, specifically caregivers and nurses, and in interviewing them, we saw that they were more affected by burnout. So what were our conclusions? We saw that domestic work is a very arduous task. The research has confirmed this. Domestic workers suffer from mental health problems, whether they are caregivers or cleaning ladies. And we think it's very important to introduce measures to protect the health of these female domestic workers. That is all. I hope I've respected the time limits allocated given to me. Thank you.
Occupational health should be improved and protected, and your analysis of the home care workers' health problem. Without further notice, I will turn to our next panelist, Anna. Good afternoon, Anna. You are working at Fair Work as a project leader on the topic of labor exploitation, and particularly working on supporting undocumented workers in the Netherlands. So you are advocating for the recognition of labor rights for vulnerable workers, migrant workers, and also victims of exploitation. And you will present today your practical work at Fair Work with domestic workers. And so, as always, you have 10 minutes. The floor is yours. Thank you.
Yeah, thank you very much. Yeah, well, as introduced, I'm Anna Ensing from Fair Work in the Netherlands, and I'm going to tell you a bit more about our practical work with domestic workers and what the lessons that we learned from in the past few years. Let me share my screen. Yes. So to start with, I'm going to share one of our cases from last year with you. In May 2020, during the first wave of the COVID crisis, I was called by one of our Colombian volunteers. She also volunteered in an organization for Spanish-speaking migrants in Amsterdam, where they teach the visitors Dutch, among other activities. She was approached by Marcela. Like many undocumented migrants in the first wave of the COVID crisis, Marcela had lost her accommodation, and she was desperate about where to live together with her daughter. After having talked to her, our volunteer understood that she was an undocumented domestic worker who lived at her employer's house. She had been working for this employer for 4 months, but she didn't get paid as promised. When she wanted to quit and go home, the employer postponed her departure many times and took away her passport from her. When she complained, the men in the household started to threaten with violence. Marcella protested against this and she was put out of the house. She was without the house, without the passport, and without money, but she was able to reach out to this organization for Spanish-speaking migrants. Marcella told them she wanted to go home and she wanted to prevent the employers to do the same to other women like her. The volunteers active in this organization had been trained by Fair Work in detecting signs of exploitation, and this is why they contacted us. Well, I wanted to share this case to start with, because this was a quite typical case of an exploited domestic worker in the Netherlands. We met her during our project called Exploitation Behind Closed Doors, in which we try to reach out to domestic workers and other workers who are working inside the homes of others and are hidden from society. We try to reach out to them and support them when they experienced exploitation. Well, in this case, Marcella got in contact with us and she got the protection that she needed, and the case is being investigated now. But what we learned in this project, which ran between 2016 and 2020, is that many migrant domestic workers in the Netherlands face labor exploitation. And many of these exploited domestic workers were undocumented women. And in this project, the pilot project, we experimented with innovative tools to reach out to this group and to support them. In the next 5 minutes, I'm going to do my best to share the 5 main lessons that we learned in this project with you. So, first lesson is inform and empower migrant domestic workers about their rights. Because what we experienced is that many migrant domestic workers don't realize that what they are doing is work, especially when they work in the informal sector or when they just help people where they are living. Besides, they don't always realize that they do have rights, such as labor rights, but also the right not to be exploited and the right to safely report exploitation or file complaints, also when they are undocumented. So our lesson was that we have to inform and empower domestic workers about their rights in the first place. Second lesson is reach out to hidden domestic workers in creative ways, because this was a group that is, as we said, hidden. So it's not always easy to meet the domestic workers, especially when they're living in with their employers, or to invite them to meetings. But what we learned is that they do always use internet, normally have smartphones, and that they do see messages that we send out, especially when these messages were sent in their own languages, in short, attractive ways with visuals or pictures. And the other thing is that many migrant domestic workers do reach out to migrant organizations or to people with the same language or cultural background. So it was important to work together with these type of organizations and with cultural mediators, because they were better able to make the first contact. Then third lesson is involve other people to see and support exploited domestic workers. Well, in the first place, domestic workers themselves do, of course, have very relevant knowledge and information about other people in the same situation. So it works very well if you involve these people in processes of empowerment and information provision for this group. Also, small migrant or support organizations normally know the informal networks of these groups, so it also works to work together with these organizations. And we also try to experiment with awareness raising among people that come into private houses because of their work, such as, for example, a plumber. yeah, because they are people that could see, they could possibly detect signs of exploitation of people who are working inside the homes of others and would otherwise be hidden. Then fourth lesson is be extra careful when domestic workers face multiple dependencies. Yeah, domestic workers who are dependent on their employer, not only for their income, but also for their housing or residence permits or sometimes social contacts. They have a lot to lose, so they will be extremely careful in filing complaints because they can lose it all. And another thing that we learned is there are also migrant domestic workers who are working for their own relatives or within their own cultural community, and they are dependent on the social networks they are in. And it's difficult for them to lose these networks, but they can also be exploited. Yeah, so we learned also that it's important to speak to people alone and to provide alternatives, for example, in housing or income, so that people are able to step out of an exploitative situation. And providing alternatives was sometimes also possible by working together with these migrant and support organizations with their own networks.
Sorry, Anna, just you have one.
Okay. So fifth lesson is very important. Safety and protection are crucial for exploited domestic workers to look for help. Yeah, as was already, I think, highlighted also by other speakers, migrant domestic workers, especially when undocumented, they are vulnerable for exploitation, but they also always fear and also risk immigration enforcement. So it's very important to have safe complaint mechanisms, so they can report a file complaints safely. Sorry, I'm now under pressure because of the time. Well, these were our 5 lessons. I wanted to highlight that we are now in an international project in which we want to share all these strategies and lessons among each other. The project is called Hidden at Work, with partners from Austria, the Netherlands, and the Czech Republic. And I also wanted to highlight that apart from these very practical strategies, it's of course also very important to advocate for improvements at policy level, especially policies that reduce the vulnerability of domestic workers. And I'm thinking now of legal pathways for migration, effective complaint mechanisms, but also, for example, the ratification of the ILO Convention 189, which is not ratified in the Netherlands yet. I don't know if there's still time for a very short video, an example of a video that we use to reach out to domestic workers. It's only 15 seconds.
Yes, of course. I think video you can Dimitri, you can play the video. Dimitri, can you play the video?
Aude, maybe we can go to the next speaker. Oh no, okay, the video is there.
Can I only just say that this video was made with the support of our cultural mediators, and some of them are also domestic workers or people that have been exploited before. So thanks very much also to them.
Thank you, Anna. Thank you so much for presenting this 5-main strategy to improve migrant domestic workers' rights in the Netherlands. And so we understand that effective complaint mechanism, but also legal pathways for migration and the ratification of the ILO Convention in the Netherlands are crucial to reducing their vulnerability. Thank you very much. And now I will turn to Avril Sharp, who just joined us. Thank you for joining us. So you will speak in English and share a presentation, I think, and you will give us an overview of the situation in the UK. So while you're sharing your screen, I will make a short presentation. So you are a charity supporting migrant domestic workers. And at Callahan, you are providing direct advice, but also support to domestic workers. And you're also leading on the policy and campaigns work at Callahan to better improve the conditions and protection of domestic workers. So thank you for joining us. I will let you share your screen. And the floor is yours. And you have 8 minutes.
Thank you very much. Okay, so yes, thank you very much to the organisers for inviting Callahan to speak today. For my presentation, I'm going to be speaking about the ongoing fight to restore rights for workers in the UK. So this began in 2012. Actually beforehand, when the UK government at the time opened a consultation in which they outlined significant changes to the terms of the visa that workers used to enter the UK. So from 1998 until 2012, the UK permitted workers to accompany their employers to the UK from abroad and enter on a specific visa for that purpose. So this visa regime, what we call the original overseas domestic worker visa, was recognised nationally and internationally as the best way to protect workers from abusive employers, as it recognised workers as workers in their own right, with an independent immigration status, which gave them certain fundamental rights, including the right to change employer, the right to renew their visa, so long as they could demonstrate their labour was still required, the right to be joined by their spouses and children in the UK, and ultimately to secure settlement here. So in 2012, the year after the UK government abstained from voting to ratify Convention 189, they implemented these drastic changes despite warnings from civil society organisations and workers themselves of the risks in doing so. These changes meant workers were tied to their employers and denied the right to change employer, even when they were experiencing abuse. So since these changes took hold in 2012, there have been numerous parliamentary committees, reviews and reports that have condemned these changes and the impact that they have had on workers. Callahan has been and continues to be the only organisation in the UK monitoring the effect of these changes on working conditions. We produce these for our annual reports, which have consistently demonstrated that rates of reported abuse are significantly higher when you compare those workers who entered the UK under the tied visa regime compared with those who entered on the original visa and had rights that allowed them to challenge abuse. In 2014, the UK government introduced a bill to consolidate all offences relating to modern slavery. This, for us, presented the first legislative opportunity for us to again highlight the need to restore rights under the original visa and the importance it played in preventing abuse. Unfortunately, our amendments to the bill were rejected, so the tied visa remained, but the government did agree to commission an independent review, which came out in December 2015. This made a number of evidence-based recommendations and concluded that the existence of the tie to a specific employer and the absence of the universal right to change employer and apply for extensions of the visa are incompatible with the reasonable protections of workers in the UK. The government responded to the review in 2016 and finally, after 4 years, accepted that workers needed an escape route from abuse. They reinstated the right to change employer, but only during the term of the visa, which remains capped at 6 months and with no right to renew. So the problems that workers continue to face, workers arrive in the UK with less than 6 months remaining. For many, it can take them, time in order to find the strength in order to leave, not knowing what their limited rights are in the UK, not knowing where they're going to, gain an income from, what rights that they have. Many also flee without possession of their passport containing their visa, so they're not able to demonstrate that they have the right to work in the UK, which leaves them subject to the UK's hostile environment for migrants. They're also without recourse to public funds, which means that they are resigned to accepting any work that they can find and be offered, or become destitute. This ultimately undermines the rationale for being able to change employer, which was to allow them a safe route out of an abusive situation and find safe and decent re-employment elsewhere. So this is the situation as of today, unfortunately. Earlier this year, we did launch a parliamentary petition calling on the government to reinstate the terms of the original overseas domestic worker visa. We were thrilled to have received over 10,000 public signatures, which meant that we were guaranteed a government response. The government's response came the day after International Women's Day, and was hugely disappointing for a number of reasons. Namely, they have said that they have no intention to reinstate the terms of the original overseas domestic worker visa. In doing so, they have ignored the important and vital role that the visa played in preventing abuse and making sure that conditions don't deteriorate to the point of modern slavery. There is also a continued failure to distinguish between labour abuses and exploitation. In the UK, we have a specific framework for supporting survivors of modern slavery. At Calayan, workers, some of the workers that we see there have suffered labour abuses, but their treatment does not amount to exploitation, which means that we cannot assist them with making an application for protection as a survivor of modern slavery. Ultimately, the government's response continues to fail to acknowledge the direct role they play themselves in not allowing workers to renew their visa. So a very disappointing response earlier this year, but we are continuing to lobby. In the UK, as of next week, we are due the second reading of the Sovereign Borders Bill. So we will be using that as the next opportunity to try to reinstate rights for workers. Thank you very much.
Thank you very much, April, for this overview and your call for the UK to stand with other countries and ratify the C189 to ensure workers are treated with the dignity they deserve. We will switch to the next speaker, but please feel free to share your questions in the Q&A, and then we will discuss after the presentations. Next speaker is Marianne Halle. Marianne, I will present you briefly. You are in charge of policy and advocacy at CCSI in Geneva. It's a local non-profit organization defending migrants' rights. And one of CCSI's main focus is on undocumented families and their children's access to health and education. And so you played an important role in the Papyrus operation. It's a regularization scheme implemented in Geneva in 2017 and 2018. And so we definitely would like to know more about this operation. So the floor is yours and you have 8 minutes. Thank you.
Okay, thank you very much for the invitation. Thank you to Lilana also for putting me in touch with you. So yeah, the scheme that was a pilot project that was carried out in the canton of Geneva in Switzerland, and that ultimately gave access to legal status to approximately 3,000 persons. So it was a pretty large scale operation for Geneva. So the starting point of this operation, I'm going to dive right in so that we can have time for a discussion after. The starting point of this operation was that basically in Geneva, we have an undocumented population that was around between 8,000 and 12,000 people. Obviously, impossible to know for sure exactly how many people were there. And about 75% of those 8,000 to 12,000 people were women who, like 99% of them, worked in the domestic sector. The situation in terms of regularization pathways before this operation was that it was, well, there's one article in the law on foreigners in Switzerland that allows for humanitarian regularizations, but it was a long, as in like several years long process that was very arbitrary in the sense that it was very difficult to predict outcomes for persons who would process a claim. And there were in the end extremely few permits granted, like a couple hundred over the past like 10 years before this scheme. There were also almost no other possibilities for obtaining legal status for undocumented workers from third countries, in the sense that in Switzerland, we have a sort of dual migration system between the EU on the one hand and everything outside of the EU, even though we're not part of the EU technically. We have all the third countries that have virtually no possibilities for obtaining legal status unless you are an extremely highly qualified worker. So that's the same, I think, in many countries in the EU. The other starting point was obviously that being undocumented, as it is everywhere in Europe, is still a major vulnerability factor for all the reasons that we've mentioned before. But I mean, typical of being undocumented in Geneva is having obviously low wages, extremely difficult working conditions, also very important housing issues. Geneva has a huge housing shortage, and so access to housing is a major issue and a major vulnerability factor when you can't sign a lease on your own and you have no access to subsidized housing. Also limited access to health services, because in Switzerland we have health insurance that we have to pay for. It's not a social security system. And so without health insurance, which is extremely expensive in Geneva, you have limited access to health services. And also one of the main factors that sort of triggered this operation was the acknowledgement that many undocumented migrants were falling victim to different forms of crime and abuse and were unable to report those crimes to the police or to other actors for fear of being expelled from the country. So in terms of domestic workers and the part they played in this operation, they played a hugely important part. First, the fact that domestic workers were making up the bulk of undocumented migrants in Geneva was crucial to raising awareness about undocumented workers in general. There was the first step towards regularization in Geneva was a study that was carried out in 2005 that concluded to the fact that the domestic sector played a hugely important role in Geneva's economy, because in Geneva there's a major shortage of before preschool care, elder care, etc. And so there was a study that concluded to the fact that without these undocumented workers filling those gaps, there would be massive negative consequences on notably women's access to the labor market. So that was an important starting point. And it was after that study that the government of Geneva initially requested from the federal government in Bern 5,000 permits for the domestic sector. And that was in 2005. And that request never sort of came to fruition, but it was the first step in this regularization that was indeed carried out 12 years later. But it's interesting to see that the first step was linked 100% linked to the domestic work sector. I think also that there was increasing awareness about the specific vulnerabilities of undocumented domestic workers, and the need to address those vulnerabilities. I mean, Lilana touched upon them in the initial presentation, and I think everybody here is aware of them, but the fact of being, isolated, incredibly dependent on your employer, all of the things that Anna mentioned as well, being, not having the same access to the local language necessarily, and having, sometimes your housing dependent on your employer. And then, so there was also a gradual realization, thanks to the involvement of domestic workers in this issue, that regulating the sector of domestic work could only occur hand in hand with regularization. And I think that is one of the main points that I want to stress today, is that really it became clear, thanks also to the advocacy that we carried out, but it became clear increasingly that there was no way you could hope to regularize that sector as an economic sector or a work sector per se, without regularization for the workers themselves. So what we tried to achieve with this program was to first open new pathways to legalization, so making the criteria for regularization a lot less restrictive than they had been precedingly, because basically up to this operation, regularization was virtually only available to families who had children who were adolescent, and so who had spent their adolescence in Switzerland. And if you didn't have that, or severe health problems, and I mean severe, there was virtually no hope for regularization before this operation. So that was the first things. It was like opening regularization to a broader sort of scope of people, and making the procedure also more adapted to the realities on the ground. So taking into account the sort of circular migration that sometimes happens, or taking into account the work sectors and all of the conditions on the ground. Another thing that we had to do was design a sort of more fluid process, in the sense that, as I said, the procedure initially is extremely long and complicated and sort of non-transparent. And one thing that was clear to us before starting this is that if we did not design a more fluid process, it would be impossible to take into account a large amount of cases in a short amount of time. So we did a lot of work on the procedure itself. And third, which was also a very crucial point for us, was to eliminate sort of the arbitrary nature of the process, because when you introduce this operation, introduce the claim to regularization, you had very little visibility as to the outcome of the procedure, because you never really knew what the authorities were going to take into account when they looked at your claim, and what they would use to reject your claim if they so wished. And so that was one of the main focuses of work for this procedure. So what we ended up with,
just have 1 minute left.
Okay, so what we ended up in the end was 5 criteria. So a duration of stay of 5 to 10 years, and being employed, obviously, being financially independent. Integration was having an A2 level in French, and not having a criminal record. So those were the 5 criteria that were decided on for regularization. But you can see that these are all sort of objective yes or no criteria. There's no gray area. It's like, yeah, either you have them or you don't. And then we worked on a standardized procedure with foreseeable outcomes, which is linked to the criteria above, and a certain number of accompanying measures, which I can get into in the Q&A later on, but I'm not going to get into that. I think what was crucial for domestic workers in particular during this in this operation was, number one, being able, and this was new in this particular project, being able to introduce a claim without having the support of any of the employers. That was hugely important, because if you don't do that, then you exclude all of the workers who are most vulnerable. Before this operation, it was impossible to start a process of regularization if you didn't have at least one employer with you. Second was that the labor market controls that were associated with this operation only took place after the person had obtained her permit. That's also very important in terms of protecting the workers, not exposing them to labor market controls before having the permit. The third point was the possibility for working poor to also access regularization. As you can see, one of the criteria is financial independence, but some of the workers were not financially independent, even though they were working 100%. And so we were able to introduce those also in the procedure, and that was also very, very important in the domestic sector. And finally, having tolerance for a lower language requirement for live-in domestic workers who were in English-speaking families, because Geneva is French-speaking, and but some of the workers were not able to learn French because they were living in with English-speaking families or Arabic-speaking families, and had no access to French classes, and we were still able to get them into the procedure. So that was very important. So one more slide, but it's a quick one. So what this experience shows, in my opinion, is that it is possible to implement a more generous and humane regularization policy, include technically and politically. It's possible. So we did this in Geneva, and so it should give other people hope. Neither of the feared consequences of such a scheme materialized. There was no influx of migrants linked to this operation, which was one of the consequences, and almost all of the persons who were regularized maintained their financial independence after regularization. So that was also a very good outcome. Obviously, the effects on the lives of legalized persons were overwhelmingly positive. And the bonus point of this operation, in my opinion, was that there was a massive increase in awareness about the issues related to the domestic work and care sector in Geneva. I'll stop there. Thank you very much.
Thank you, Marianne. Thank you very much. And for sharing with us your inputs on this project. I think it clearly echoes Liliana's presentation, and you also rightly point out that implementing a more humane-oriented regularization policy is possible. So thank you for it. And without further notice, I will turn to our final panelists. Petra Ezzedine. Thank you, Petra. So you are an assistant professor at the Department of Social and Cultural Anthropology at Charles University in Prague. And recently you co-founded the international research network called Euro Care Together, and it focuses on the mobility of seniors and on elderly care in Central and Eastern Europe. So thank you for joining us. And you will talk about intra-EU migration with the presentation of domestic workers' migration pathways in Central and Eastern Europe. So I will leave you the floor, and you have 8 minutes.
Yeah, thank you very much for introducing me. I just want to mention the co-author, Zuzana Uda, of this presentation, because we are long-term academic partners in crime. So I would like to mention her here as well. And I'm also here presenting Association for Integration and Migration in Prague, which is an organization focusing primarily on migrants, but also since 2011, we are trying to advocate for migrant domestic workers' rights here in the Czech Republic. We have launched a few social campaigns as well, and also we did quantitative and qualitative research in this particular field. And it's a member of PICUM. Here I'm just trying to show you, and I will copy those articles and studies on this particular topic, because I'm going to present a little bit different perspective today. So perspective of receiving, of sending countries, not receiving countries. And here are really new, fresh, new articles from the region, so done by regional experts from Austria, Germany, Czech Republic, Slovakia, Hungary, and Poland, which are focusing on the elder care industry and cross-border care regime in the region, and also focusing on a specific situation during a pandemic COVID-19. I'm going to touch this topic also a little bit later in my presentation. What is specific in our region? This is a specific EU intra migration. So this specific cross-border care regime is based on a work rotation in 2 weeks or 1 month shifts in a 24-hour service. So women from Poland, Czech Republic, or Hungary, Slovakia are working in Austria or in Germany, and they rotate. So they work 2 weeks in Germany, then they go back home. So they're trying to continue with their unpaid reproductive work back home. Those care workers are affected by gender inequalities in our region. So mostly there are single mothers or women 50 plus, which are quite vulnerable in the local labor markets. and also they are actively preparing for their own retirement. So for example, in my research among Czech care workers working in Austria, I have found women in the age of 72 actively preparing for their own decent retirement in the Czech Republic while working as live-in care worker in Austria. The specific formalization of this kind of care migration, cross-border EU care migration, is based on agency work. Most of those women work as self-employed workers, so that therefore they are excluded from ILO Convention 189. And here we can see the map of our region and some quantitative data based on average monthly salary. And we can see dividing line in between Central and Eastern Europe, so-called sending countries, and those who are receiving care workers, EU care workers from our region, just to visualize regional, structural, and economic inequalities in the region. Here I'm showing you a materialized symbol of COVID-19 face mask used by care workers while crossing borders in between Czech Republic, Austria, or Czech Republic and Germany. They call themselves pendlers, and they try to visualize themselves in order to go smoothly through the borders. This became to be kind of symbol of their specific situation during the COVID-19. So what was happening in our region? We have experienced such interesting media discourses and political negotiations in between our ministers, I mean ministers in the region and ministers of health, especially in Austria and Hungary. We heard from German and Austrian newspapers calls for care bonds, which supposed to have care workers from our region to older people in Germany and Austria. They stressed moral pressure, or we could hear a moral pressure to come. Even borders specifically last year were closed. Even we are still speaking about EU migration. So what was really interesting, and we tried to collect those data, what was happening with care workers, with those EU care workers while borders were closed. They had to experience 40 days of obligatory quarantine period, strictly isolating themselves at home, which meant that that in the specific rotation system, they spent 2 weeks at home isolating themselves, not working in their unpaid reproductive work for their own families. There was the obligation to prove negative results of COVID-19 testing, which they had to pay themselves at the beginning, and it was quite a high expense for them, so nobody cares that they had to do testing, but they were called to come because elderly people are waiting for them. They often face a social stigmatization as potential virus contaminators in their local communities. For example, I spoke with one woman here in the Czech Republic. She was not allowed to bring her child to the kindergarten because she was labeled as a care worker working in Germany, so someone who could potentially contaminate the other people in community. And also they face similar stigmatization in Germany and Austria. They were lacking adequate information about COVID-19, and they were in the need of safety and sanitary equipment due to their self-employed status and informal character of their work in private households compared to those who work in formal sector. And of course, they had to stay longer in Germany and Austria. So for example, some of them, they stay 5-6 months in compared to 2 weeks or 1 month. Because they wanted to avoid problems related to biopolitics and borders, and also they wanted to minimize potential risk of losing their jobs. The paradox of this situation is that the number of cross-border care workers is rising due to the COVID-19 because, as I mentioned before, those women, single mothers, women 50 plus from the region, some of them, they lost their jobs here in the region due to the COVID-19, especially those who work in hospitality services, spa, industry, etc. Here, I'm just trying to show you the voices of women from my ongoing research with Czech care workers who are working as cross-border care workers in Germany, who try to reflect the situation during pandemic-19. So you can really read and hear their voices, how they were affected by pandemic situation. But borders became to be closed. They were not just suffering subjects of their own situation, they had protests. So we could really observe protests on border crossings, not just in the Czech Republic here, but also in between Slovakia and Austria, and in between Austria and Hungary, and especially women, they try to express their specific vulnerable situation. They were in the need of these salaries as caregivers, but also they had to pay for their tests and all the equipments, and also they blame their sending countries that they are in a specific vulnerable social situation back home. So we observed this, and also they supported each other, and they organized themselves somehow in their Facebook support groups, which played a crucial role in order to manifest their rights and needs during the COVID-19 situation.
Sorry, Petra, you just have 1 minute left.
Yeah.
Thank you.
The cross-border care labor market is not a win-win model as it's often portrayed. The European care border regime creates a legal scheme of nationality-based structural inequalities and exclusion amidst a mix of egalitarian and integrated Europe without borders. And it's not just based on my today's presentation, but also on our long-term studies in region. Although care workers have been praised as essential workers, and we observed Austria sending trains to Romania while picking up Romanians on the edge of pandemic situation and then isolating them for free in hotels in Austria, there is a persistent effort to exclude EU migrant workers from full enjoyments of social rights. And this is really interesting, and we have to perhaps think about it more, that this is based on the shared and entangled political history in Central Europe. Ethnicity here is a silent asset because of a similarity and cultural closeness and common history in the region. But of course, economic inequalities play a major role. And here I prepared some recommendations for policymakers, long-term plans, which are more focusing on somehow paradigmatic shift on economy based on care, on how the idea of aging in place is based on the precarious labor of cross-border migrants and is not sustainable anymore. And then we have to rethink the other alternative of distant forms of elderly care in the future. We have to minimize regional inequality, economic inequalities in care markets in EU, because of course it's caused care drain in sending countries. And of course, I prepared somehow short-term plans to financially acknowledge care workers with decent salaries. Migration policy has to interact with social and health policies in EU, and states have to guarantee transnational social rights, not only for EU care workers. And here I have to mention Austria, which is neglecting EU care workers, not just care workers, but labor migrants from their system of child benefits and family taxation. And of course, European Commission is calling for repairing this specific law, but since 2019 we are observing those specific inequalities which are creating the population of second-class children of EU. Thanks for your attention.
Thank you very much, Petra, for your input, and particularly on the impact of the COVID-19 crisis on these workers and your key recommendations. I noticed, because we are running out of time, that we have questions in the box, but for all which cannot follow clearly, don't worry, all presentations will be available and will be sent by email after the event. So first, I have a question. I think it could be for you, Liliana, but just tell me. A question in Italian: many domestic workers leave their children in their countries of origin or in the care of grandparents, uncle, friends, or in orphanage to come and work in Italy to look after our loved ones. I think this is a huge social scourge that needs to be addressed. Is the European Union paying any attention to that, to this issue? Maybe Liliana, you have any input for us on it?
Sure, yeah, happy to respond. I mean, at EU level, there's a directive, the Family Reunification Directive. So that would apply to regularly residing migrants that have a work permit of 1 year or more. Right to family reunification. The problem is in implementation, there's sometimes income thresholds, which would mean that it'd be very difficult for on national level. It's been imposed that you have to have a minimum salary, say, to bring your children, and that could be difficult for domestic workers. And then the other point, as we described, that it's just really hard to get that work permit, and that because domestic work is not being properly included in the general work permit schemes or being blocked through these other mechanisms, it's just too difficult to really get that permit when, and you know, and then to have the rights that would come along with it. So that's why we're really focusing on trying to improve access to those work permits.
Thank you very much, Liliana. I also think you, Francesca, you had a question about the availability of your report, but you posted in the chat box, so thank you for it. Thank you very much. And I also see in the Q&A box a question for you, Petra, on the, well, sorry. But I think you answered, but maybe you can answer for everyone. What are the main destinations countries in Europe for DEC and other CE domestic workers? Very briefly.
Thanks. Mainly Germany and Austria, because they can do this rotation cycle of 2 weeks or 1 month. So they're not located. So they're located in the region. But there are also some new destinations as Netherlands, Belgium, and Switzerland. And there are also a few schemes in between Caritas, in between, for example, Switzerland and Slovakia, or Switzerland and Romania. But I'm going a little bit farther from our region, which is trying to somehow make more decent conditions in between sending and receiving countries to let's say balance these inequalities in between in the regions due to the special scheme of rotation, and also of their legalization of their status as some guest workers. Yeah, but still what we found out as researchers in the region, these programs are not eliminating those inequalities and vulnerabilities for live-in care workers in general, let's say. And also, it's important to say that, for example, Poland and Czech Republic are also receiving countries of care workers. So mainly women from Ukraine or from Moldova or from Philippines are also coming to our countries. It's a new phenomena, and we are also taking attention to this particular phenomena. So this is something which is creating some paradoxes of care. Plus, we have here special type of mobility of seniors, relocation of German seniors to Poland, Czech Republic, Slovakia, and Hungary to formal elderly care in facilities, where they are sometimes cared by Moldovan and Romanian domestic, not domestic workers, but care workers, because they work in formal institutions. So we see such paradoxes of care mobility, especially in the field of elderly care in our region.
Thank you, Petra. And I have a very last question about what about some of them are there posted workers? Maybe you can answer to it.
Not exactly. I think it's more the case of in Poland, or sometimes women from Ukraine are using visa to Poland in order to enter German care market as live-in care workers. But as Lian already explained in her presentation, it's quite difficult to formalize the position of live-in domestic workers in, for example, in the Czech Republic. So they find different ways, quasi-legal ways how to work and be employed. And some of them are also not in a regular situation.
Thank you, Petra. I don't see any more questions in the Q&A box. Just let me check. Okay, I've got a question in German. I don't speak German, just wait. Well,
do you have a
think-
German translator, or do you want me to do it?
Is the question for you, Marianne?
No, it's not for me, but I happen to speak German.
Okay, but I think we are 5 minutes ahead of time, so I will have to conclude. I'm the very last question, but our panel is coming to an end. Thank you for all interpreters for their time, and thank you very much. It's been a pleasure to all speakers. It's been a pleasure to see all stakeholders gathered on this today's event for a common goal. Well, I'm supposed to share my screen to give you information about the Wonder platform. Just okay. And I really would like to thank all panelists for taking the time to present their ideas with us. We've learned a lot about different contexts in different countries and how public authorities are tackling migrant domestic workers and their integration. And we were very glad to hear about your perspective and challenges on the challenging and you had or you're facing, and how you try to raise awareness on the situation of domestic workers, migrant domestic workers. So it was very inspiring, and can show that improvement are possible. So we truly hope that our discussion are contributing to improve domestic worker situation all over Europe. So now we will have a 30-minute break, but please don't leave. And you will have the link to go to the Wonder platform. So feel free to use it. And then we meet at 3 for the closing session. Don't forget to connect a little bit in advance to follow this various session. And from my side, I can't wait to hear what EU decision makers will respond to political recommendations made by members of the Alliance. So thank you very much all again, and see you.